A 3-day-old newborn presents with jaundice since birth. Examination reveals pallor and hepatosplenomegaly. The newborn also has a cephal hematoma. Which one of the following is the most important indicator to the diagnosis of pathological jaundice? Clinical jaundice since birth. What is the diagnosis of autism spectrum disorder? Primarily based upon clinical criteria only. According to National AIDS Control Program, which one of the following drug is given to newborns born to HIV positive mothers to prevent mother to child transmission of HIV infection? Nevirapine. Which one of the following statements is correct in context to human breast milk? Human milk contains omega-2 and omega-6 very long chain fatty acids. Which of the following are age appropriate language milestones in a normally developing 2-year-old child? Vocabulary of 50 to 100 words, use of pronouns, occasional repeating of words. Which of the following tools are used for developmental screening? Danvers Second, Age and Stages Questionnaire, Parents Evaluation of Developmental Status. Liver transplantation criteria. According to King's College criteria, which of the following are indicators for referring to liver transplantation? Following acetaminophen toxicity. Academia, serum pH less than 7.3 after adequate fluid resuscitation, coagulopathy, INR greater than 6, renal dysfunction, creatinine greater than 3.4 mg per dl. Which one of following statement is correct about intradermal fractional inactivated polio vaccine FIPV with respect to intramuscular IM IPV? FIPV is 1/5 of IM dose of IPV. Which one of the following statements is correct regarding the Government of India program home-based care of the young child? The infant is monitored from 3 months to 15 months of age. In a child with high anion gap metabolic acidosis poisoning suspected iron. Which one of the following is a danger sign for a newborn baby? Respiratory rate more than 60 per minute. Specific type of permanent teeth, canines, premolars. Urinary alkalization is used for enhancing excretion of which of the following poisoning? Phenobarbital poisoning. A 4-year-old child is brought with a history of ingestion of 1 gram of paracetamol 2 hours back. What should be initial management? Gastric lavage. Antidote to reverse the muscarinic effect of organophosphate toxicity is atropine. A 7-year-old child is brought to emergency with seizures and drowsiness. The child had been receiving some drugs for fever for past 2 days. Child is found to be cyanosed with an oxygen saturation of 40% and unresponsive to oxygen therapy. Blood gas analysis reveals a normal PaO2. Which drug intake may have caused the above condition? Chloroquine. Autism spectrum disorder characterized by onset before 3 years of age, impaired verbal and gestural communication, stereotypic and restrictive behavioral patterns. Which vaccines are stored in the top rack of main refrigerator compartment at temperature 4 to 10 degrees Celsius? BCG, measles and MMR vaccines. Identification of 4Ds is a key element of which National Health Program? RBSK Rashtriya Bal Swasthya Karyakram.